Dr. Sarah Jarvis, welcome to the University of Huddersfield. First of all, how do you feel about receiving your honorary doctorate?
It's hugely exciting. I worked very hard to become a doctor, but I have to say it's my first honorary award, and it feels hugely exciting, but particularly because I worked so closely with Professor Karanuzi, and she's such an inspiration. I've heard so much about the University of Huddersfield and all the work that they have done. So I feel very privileged and very honoured to be here.
Now, we have a lot of students graduating and they're going out into the wider world as we speak. What were you planning to do at that stage, and did the reality actually match your plans?
Well, if there's one thing I was going to say to students, it's follow your dreams, but do be aware that your dreams might change, and that's okay. I'm very conscious that I was extremely different to most people. I have wanted to be not a doctor, I've wanted to be a GP since about the time I turned 8 years old. When the GP came to our house, he gave my father an injection, and unthinkable today, he gave me the used needle and syringe to play with afterwards. And I used to inject my teddy bear with Ribena very carefully, and I kept the needle in a sherry cork and looked after it beautifully. And from that moment, all I wanted was to be a doctor. Now, it was really important to me that, you know, when I was a child, my brother wasn't given a doctor's uniform and I wasn't given a nurse's one. The theory was always, you can do whatever you want. I've never regretted going into general practice. It's the most extraordinary, rewarding profession, but it's not at all as I expected it, and that's okay too.
Okay. Now, you are patron of our Institute of Skin Integrity and Infection Prevention. Why is its work so important?
I don't think anybody out there today can fail to understand quite how important infection prevention is. During the pandemic, we had the most extraordinarily steep learning curve in terms of how COVID was transmitted, for instance. It fundamentally changed the advice that I was giving as a doctor, and really, really important that when people pushed back and said, but at the start of the pandemic, you weren't recommending face coverings. No, I wasn't, because we didn't know then about aerosol spread. We didn't know how easy it was to transmit COVID without the use of coughs and sneezes. So if we didn't have this institute, we would be possibly, and institutes like it obviously, we'd be much, much slower to understand emerging diseases. We'd be in a much worse position to understand emerging threats to our health, antimicrobial resistance and so on. So I don't think there's ever been a time in history when the role of the Institute has been more important.
Okay. You're also our visiting professor of general practice, and given the variety of health-related courses here, how wide-ranging a remit is that?
General practice is actually the single biggest medical specialty in the UK. It is very much a specialty in its own right. I specialise in general practice. That means that I have a very different role to that of a hospital specialist, because my role is to triage, to tease out what needs to go forward, what can be dealt with in general practice, and of course, increasingly, to deal with more and more complicated patients. So I virtually never, even in one consultation, deal with one problem. I'm usually dealing with 4 or 5, and you don't learn in the textbooks how any combination of 4 or 5 interact together. It's all about putting it together and working out the impact on the physical and the psychological and the social health of a patient.
Okay. Now, we're about to start construction of a new National Health Innovation Campus just near the campus here. How important do you think facilities like that are going to be with health challenges that we know about and possibly ones that are coming down the line?
Perhaps one of the most exciting things I've heard is about this development of the National Health Innovation Campus, because we are in a position we have never needed innovation more in the NHS. Science has moved forward dramatically, but unfortunately, new science, new developments do mean that we have to think differently. Long gone are the days when having a baby was an illness or a hospital procedure and you spent 2-3 weeks in hospital. We've had to learn to think outside the box, to think really innovatively in terms of how we can help people to help themselves. And again, Sadly, there are far more lifestyle challenges today than there were even when I became a GP a mere 32 years ago, and certainly far more than when I was born. Obesity is a classic case in point. Very, very sadly, the incidence of obesity has about doubled with every 15 years, and we're now at the position where almost 30% of adults are overweight or obese. That carries huge health challenges, and we really need to help people to help themselves, because frankly, it's not just alcohol, drugs and tobacco which are addictive. Food can be really addictive too.
Okay. Now, you've been a very familiar face and voice throughout the time of the COVID pandemic. What do you think the pandemic has done to the public's perception of health issues, given how forefront it all of a sudden was to everybody a couple of years ago?
It is extraordinary to me that I went from doing Radio 2 once a week for 19 or 18 years to the last 2 years. The first few months of the pandemic, I was talking every day, and not just on the air every day, but on the air talking about one topic every day. It's not remotely surprising that it occupied all of our interest. People were terrified at the start of the pandemic because we didn't know enough and we didn't have vaccines, and we saw the experiences of other countries where people were dying in their droves. So it's not surprising, but what does worry me a lot is that at the early stages of the pandemic there were reductions, for instance, of over 50% even in people presenting to hospital with chest pain and a possible heart attack. It really made people too terrified to seek healthcare. What we've seen since then is things have gradually come back, and people have been, firstly, which is good, much more conscious of their health on the whole. They are aware that there are certain risk factors which can greatly reduce their chance of becoming seriously unwell, whether it's with COVID or another serious condition. They've also become, I think, much more aware that there's much they can do rather than having to present to the doctor. So pharmacies are highly underused, or were highly underused, sources of expertise. Pharmacists are very well trained, and yet they weren't being used enough before the pandemic. We are finding they're being much more incorporated into the core part of self-care and general practice. So all those sort of things I think have really changed. But I also think, of course, we can't fail to mention the elephant in the room. One year we were clapping, the next year the newspapers are full of negative stories for the very same doctors and nurses who are working every bit as hard now as they were throughout the pandemic, and that is very hard indeed.
What would your advice be to our students who are graduating now, in particular those ones who are graduating from healthcare and healthcare related degrees?
If you're graduating in any degree, but particularly, and I would say this, wouldn't I, from a health and healthcare degree, be very, very proud of what you are doing. You will change lives, you will save lives, and you will make a huge difference. You do need to look after you. We've seen during the pandemic people working longer and longer hours, and there is an awful lot of pressure. So look after you, but be proud of what you've achieved and what you're going to achieve.